Hi, I'm Marty Jolly, Director of Nursing with DakotAbilities. Thanks for joining me. We're going to go ahead and take some time to talk about type 1 and type 2 diabetics. Type 1 diabetics are also known as insulin-dependent diabetics. And the reason for that is that their body is not releasing the insulin that it should be to break down sugar. The job of insulin in our bodies is when we consume sugar, the insulin grabs onto the sugar and helps us metabolize it, basically breaking it down so that we can use it for energy and energy stores for later. So if we have a type 1 diabetic and their body's not releasing insulin the way that it should be, they are insulin dependent. They have to have the insulin to break down the sugar to stay alive. What happens if they don't take insulin is the sugar builds up in the blood. So then the question becomes, why is that a problem? If that sugar builds up in someone's blood, what kind of issue is that going to cause? Well, let's go ahead and look at an example of that. Typically, blood is going to flow pretty easily throughout our veins and arteries and then come back up to the heart. So typical blood flow, flowing very easily. The heart does not have difficulty pushing that fluid through, and that fluid is then carrying oxygen to the needed cells so they can stay alive. Well, if a person is a type 1 diabetic and doesn't take insulin to help them break down the sugar, that sugar builds up in the bloodstream. So that blood goes from being thinner to being thicker. And when that blood becomes thicker, the heart has a much more difficult job of trying to pump that thick blood throughout our system. So if that blood can't get throughout our system, then we're not getting oxygen to all our needed tissues. When you think of the eyes and how small those cells are in our eyes, if the blood isn't flowing through those eyes and getting to where it needs to be because the heart can't push hard enough to pump it there, we're going to have vision issues. The cells in our eyes are going to slowly die. Cell death comes from not being oxygenated and not having blood perfused. So the worse and the thicker our blood gets, the harder that is. So if the blood gets thick enough where it's moving this slowly throughout our body, where it's got that much sugar, that's very difficult for the heart to pump through the system. At that point, there's certainly going to be damage to tissue because the heart can't move the blood through the way that it needs to be. And that's when you hear of a person having an amputation or having loss of feeling in their feet. It's because those areas where the heart can't pump that blood through well because it's too thick become damaged and tissue death occurs. So that type 1 diabetic is reliant on insulin. It needs the insulin to go and grab onto that sugar and to break it down so that we can use it for energy. So that person is going to have to take insulin at least 3 times a day with the meals that they're taking in. They are reliant on it. That's what's going to help keep that blood flowing through their system and keep those sugar levels throughout their blood lower. And that's going to keep their vital organs perfusing. We have a better understanding of a type 1 diabetic now, but how about those type 2 diabetics? What's happening for those individuals? Well, in their situation, sometimes their cells are actually just rejecting the insulin. Their body's doing a good job of releasing insulin, but the cells aren't allowing it to work the way that it should, or to get to that sugar and attach to it to help break it down. In that situation, a person can take medications that helps to impact that process so that their body isn't blocking the insulin from doing what it's needing to. So sometimes they can take an oral med, sometimes they have an injection, sometimes things get to the point where they also need insulin to help keep the blood sugar in their body at a regular level to prevent tissue damage. They may also have trouble with low blood sugars or high blood sugars, like a type 1 diabetic. Type 2 diabetics, one thing that can significantly help sometimes with what medications they have to be on is diet and exercise. It's very important if you support anyone who's a type 2 diabetic that you assist them in a healthy lifestyle and also following their constant carb diet. They need to follow that diet to make sure that their blood sugars stay at a good level and that they don't experience tissue death or problems from their blood getting too thick. With either type of diabetic, we might have to check blood sugars from time to time. So it's important that you know how to check a person's blood sugar in those situations. The first thing we want to do, we know we're going to be dealing with blood, is we want to do hand hygiene. So go ahead and wash your hands. Make sure you wash them for 20 seconds or use your hand sanitizer. I'm going to go ahead and use hand sanitizer. When I use hand sanitizer, it's important that I vigorously rub that all over my hands and all surfaces. That's what's going to kill anything that's on my hands to prevent the spread to the person I'm taking care of. Next thing I want to do is don my gloves. I want to have that extra layer of protection because I'm going to be dealing with blood, which is a potentially infectious material. Okay? So I'm putting my gloves on to protect myself and the person that I'm caring for. Once I've got those on, I'm going to let the person know, hey, I'm concerned that you might have a low blood sugar. So I'm going to go ahead and check your blood sugar. Let's talk about some of the signs or indicators that a person you support might have a low blood sugar. Shaking and tremors can be a big indicator of a low blood sugar. Also, if that person appears glossy-eyed, possibly a little bit euphoric, like things are funnier than they really are, or if they became irrational or angry for a reason that doesn't make sense. Those can all be indicators. Some people become very sleepy as well. If they're sitting there and it looks like they're having trouble keeping their eyes open and they're a type 1 or a type 2 diabetic, we want to wonder, is that person's blood sugar low? Maybe we need to check it. Another sign can be if the blood sugar gets too low, it can actually cause that person to have a seizure. At that point, we need to act quickly. We're going to call 911 and we're going to do our best to get some sort of sugar into that person's body to stop that seizure. All right, Jim, I'm worried that you've got a low blood sugar, so I'm going to go ahead and check your level now, okay? I'm going to take the hand, and I'm just going to try to find a spot where there's not any bruising on a fingertip, and then also where there's not so much callus that's going to cause difficulty with me getting a sample with that finger poke. So I feel like the thumb is a good spot for Jim today. There's not too much of a callus. The first thing I'm going to do is I'm going to open my alcohol swab. And with the alcohol swab, it works by the rubbing action. That's why they call it rubbing alcohol. So I'm going to make sure and rub for at least 10 seconds on the finger before I move on and poke the finger. Poking that finger introduces a risk of infection to that person. Now, I've already cleansed the site. The next thing I want to do is take the safety lancet, and I've taken and spun the twist top out of it. And I've got the end where the needle's going to come out. And I'm going to go ahead and take that end, put it right up against the finger, and then I'm going to depress the button and hold for a second. Once it's depressed and I remove it, I'm going to see that the drop of blood is there. I go ahead and I take my test strip. I want to make sure I have the right test strip for my machine. With the test strip and placing it into the machine, the lines need to go into the machine, and the other end is where the drop of blood is going to go. I'm going to go ahead and take that end and put it right up to the finger where the droplet of blood is. And once the machine has enough blood on it to get a reading, it's going to start counting down. I know once I start to see the machine counting down, I have enough blood. I can set my machine aside for now while it's reading the result for me. I can place a cotton swab or a cotton ball on the person's finger for a few seconds until it stops bleeding. The needles and the safety lancets for checking a blood sugar are very small, so there shouldn't be very much blood. After a few seconds, it should stop on its own. Now I've got my reading. Jim's blood sugar is 75, and that's low. It's below 90. So I want to provide some intervention. Now I'm going to go ahead and treat with milk, juice, pop. I'm going to make sure that if I'm giving soda, that it's not a diet soda. It's got to have sugar in it. If I'm giving juice, it has to be juice that has sugar in it as well. I don't want it to be sugar-free juice or sugar-free Kool-Aid. That's not going to help get Jim's blood sugar up. So I give Jim a little bit of juice because the juice is going to bring his sugar up quickly. The next thing that I'm going to do is I'm going to give him some peanut butter and crackers. The nice thing about peanut butter and crackers is that peanut butter, that protein, breaks down slower. And so it's not going to raise the blood sugar as quickly. it's going to slowly break it down in the body so that he has a blood sugar that's steady, that's not jumping up very high and then dropping very low. So using protein to help with that low blood sugar is a great option. Thank you for joining me.